Hello, my name is Dr. Diwan S. Raja. Today I will discuss about osteology of hip bone. We have some questions and answers. What is a hip bone? A large irregular bone made up of three parts, ilium, ischium and pubis. The three parts are united to each other at the acetabulum. So this is the irregular bone. It has three parts, the ilium, the ischium and the pubis, and they are united at the acetabulum. What is pelvic girdle? A bony girdle formed by two hip bones. So we have two hip bones that forms bony girdle, that is called pelvic girdle. What is the anatomical position? The front edge of the top of the pubic symphysis and the anterior superior iliac spine here, anterior superior iliac spine, and front edge of the top of the pubic symphysis lie in the same vertical plane. Okay, the same vertical plane. Then the upper border of the symphysis pubis and ischial spine, this is the ischial spine is here, this is the ischial spine, and upper border of the symphysis pubis, they lie in the same horizontal plane. Okay, then the pelvic surface of the body of the pubis, this is the pelvic surface of the body of the pubis that is directed upward and backward. The symphysial surface, this is the symphysial surface here, symphysial surface of the body of the pubis lies in the median plane. So these are the points for the anatomical position of the hip bone. Okay, so how is the side of the hip bone determined? The large cup-shaped acetabulum faces laterally and its notch must be below. Okay, so this is the acetabulum and notch is here. This is the notch of the acetabulum. It must be below. Ilium forms the upper part of the hip bone. This is the ilium, and the iliac crest projects upward. This is the iliac crest. It projects upward. The obturator foramen lies below the acetabulum. This is the obturator foramen. It should be below the acetabulum. Here is the obturator foramen, and this is the acetabulum. It is bounded anteriorly by the thin pubis. This is the pubic bone, pubis, and posteriorly by the thick ischium. This is the ischium. This is the pubis, pubic bone, and this is the ischium. Okay, so we have to orient it with that of the hip bone. Which part? Let me try one by one. So if we go there, okay, so to find out, this is the anterior superior iliac spine, anterior inferior iliac spine. This is the pubic tubercle, this is the pubic crest, body of the pubis, superior ramus, inferior ramus. This is the ischium, ramus of the ischium. This is the istiopubic rami. Okay, we got that. There is the ischial spine here, the greater sciatic notch, the lesser sciatic notch. Posterior superior iliac spine is here. Posterior superior iliac spine. Posterior inferior iliac spine is here. Okay, so this is the iliac fossa area, iliac fossa, and this is the iliac crest here. This is the iliac tuberosity, auricular surface here. This connect with, it is attached to that of the sacrum from the sacroiliac joint. Okay, so if we go there, this is one of the sacrum here. Okay, this is sacrum. We can this is the sacrum and this is the sacroiliac joint. Sacrum articulate with the ilium and forms the sacroiliac joint. Okay, that is a synovial joint, but eventually it becomes fibrosed. It may be ossified by the age of 50 in most individuals. Okay, and our hip bone also articulate with that of the femur. This is the femur, head of the femur, and it articulates here. That forms the hip joint, and hip joint is a ball and socket type of synovial joint. This is the ball, here is the ball, ball is here, here is the ball, head of the femur. This is the socket here, socket is here, socket is here. So ball and socket joint, that is the hip joint. And we have joint between the symphysis pubis here. This is a secondary cartilaginous joint, and we have the subpubic angle below the pubis. So these are the joints of the hip bone. Okay, so let us go to the muscular attachment. We'll find out this image here. Okay, what structure attaches to where? This is the anterior superior iliac spine. Here is the anterior superior iliac spine is here. Okay, and okay, this is the anterior superior iliac spine is here, and this is the site of attachment of the sartorius. This is the origin of sartorius, just at the anterior superior iliac spine and just below that. We have also same place the attachment to the inguinal ligament, the lateral end of inguinal ligament. Okay, then this is the anterior inferior iliac spine that is here, and this is the site of origin of the rectus femoris, the straight head. What is the reflected head? Reflected head takes origin above the acetabular margin here. Okay, so rectus femoris has the straight head and the reflected head. Okay, so rectus femoris muscle, that is a part of the quadratus femoris muscle, and it should be innervated by the femoral nerve. Sartorius is also innervated by the femoral nerve. Sartorius is the longest muscle of the body. Okay, we got that. Then we'll go to the iliac crest here. Iliac crest on the inner aspect here, we'll get the origin of the transversus abdominis muscle here. Here is the origin of transversus abdominis muscle here. Then just behind the highest point of the iliac crest, we have the origin of the quadratus lumborum muscle. Quadratus lumborum muscle. If you go down here, in the dorsal segment, we'll get the origin of the erector spinae. These are on the inner surface. There is the pelvic surface of the hip bone. Okay, and this is this blue line indicates the attachment of the ventral sacroiliac ligament here, and this rough area for the interosseous sacroiliac ligament will get the dorsal sacroiliac ligament. We'll get also the attachment of the ilio-lumbar ligament here. Okay, if you go down, we'll get at the pecten pubis area, at the lower part of the arcuate line, at the junction of that of the pecten pubis area here. Okay, here is the insertion of the psoas minor muscle. So psoas minor muscle does not go to the femur, it ends up here, site of insertion of psoas minor muscle. Okay, this is psoas minor muscle. Then if you go down here, the body of the pubis, the pelvic surface here, here is the origin of the levator ani muscle, anterior fiber. What is the posterior fiber? Posterior fiber takes origin from the ischial spine. Here is the ischial spine. Okay, so anterior fiber, posterior fiber of the levator ani muscle. Here, this part is also related to the puboprostotic ligament. It is related to the urinary bladder, the pelvic surface of the pubis. Okay, we are going to the inner surface here, pelvic surface of the ilium. Here is the ilium, and this is we're going towards the ischium here, and we have very big origin of the obturator internus muscle. This is the obturator internus. Okay, so from entire part from here, okay, we're getting the up to the obturator foramen. This is the obturator foramen. Up to this level, we have this red area indicates the origin of the obturator internus. Okay, including this part, the margin of the obturator foramen. Okay, then if we go to the ischial tuberosity on the pelvic surface, here ischial tuberosity here, and going to the inferior and going to the ramus of the ischium, we'll get origin of the superficial transversus perineum muscle and the sphincter urethra. And if we go continue here, we'll get the crest of the penis here. We'll also get the superficial transversus perineum muscle, deep transversus perineum muscle, and we'll also get the ischio cavernous. So we'll get the attachment of the perineal membrane and inferior layer of the urogenital diaphragm here. So multiple structure here. This part, the superior ramus of the pubis, is also related to the round ligament of the uterus in female and the vas deferens in the male. Okay, we got that. So from the ischial spine, this is the ischial spine that is inverted in male, everted in female. Here, origin of the coccygeus muscle and the levator ani muscle here. Okay, we got that. Then if we go to the next slide, here is this surface, the outer surface of the hip bone. We'll get this is the ilium again. Ilium has this part is the iliac fossa, and that is the gluteal surface. That means this is the gluteal surface, and on the pelvic surface, this is the iliac fossa. We'll go to the gluteal surface, outer part of the outer surface of the hip bone. We have three gluteal line. The posterior gluteal line is here. We have the anterior gluteal line is here. Inferior gluteal line is here, and the muscle between the muscle behind the posterior gluteal line is the gluteus maximus muscle, and the muscle between the anterior gluteal line and the posterior gluteal line is the gluteus medius. Muscle between the inferior gluteal line and the anterior gluteal line is the gluteus minimus muscle. Okay, if we go again to iliac crest, has outer lip, inner lip, and the intermediate area. Okay, and we have the iliac tubercle around 5 cm behind the anterior superior spine, iliac tubercle. Okay, and structure attaching to the outer lip is the insertion of the external oblique muscle of the abdomen here, external oblique muscle here. It is also the site of attachment to the fascia lata. Also, we'll get the origin of the tensor fascia lata here, tensor fascia lata. Just beyond the highest point of the intermediate area is the area for origin of the internal oblique muscle. Just behind the highest point of the iliac crest, on the outer side, we have the latissimus dorsi. On the inner side, we have seen in our previous image, that is the quadratus lumborum muscle. If you go to that image again, here's quadratus lumborum. Just on the other side, we have the latissimus dorsi muscle. Okay, This is the muscle here. If you go here, this is again the acetabulum, and this part is called the lunate surface here. This is the lunate surface, and gap between the lunate surface is the acetabular notch, and this part is the acetabular fossa that contains a lot of fat in our body. Again, over the acetabulum we have the reflected head of the rectus femoris. From the anterior inferior iliac spine we have the straight head of the rectus femoris, plus we'll get the ligament, the ligament between the ilium and femur, iliofemoral ligament is also attached here. Okay, we are going to the pubis here. Here is the pubic. Pubis is a part of the hip bone, and we have the iliac. We have the pubic crest here. Okay, with the pubic crest, this is the iliac crest here. This is the pubic crest. Pubic crest is the site of origin of the rectus femoris and the pyramidalis muscle. Okay, here the pyramidalis muscle should be here on the pubic crest, a bit up. Plus, it is the site of origin of the rectus abdominis muscle. And this body of the pubis is the site of origin of the adductor muscles of the thigh, like that of the adductor longus. We have the adductor brevis, and from the ischium we are getting the adductor magnus. Okay, extending to the ischiopubic rami. Okay, so we got the muscles, adductor muscles. Adductor muscles are innervated mostly by the obturator nerve, with one exception. Exception is the adductor magnus, that also get innervation from the tibial part of sciatic nerve, because that is also a hamstring muscle. So we'll go to the ischial tuberosity. Here is the ischial tuberosity here. Okay, and we will divide ischial tuberosity into two part, upper part, lower part. Upper part again divided by oblique rays into the superlateral part. There is a site of origin of the semimembranosus. The inferomedial part, site of origin of the semitendinosus, long head of biceps femoris muscle. And below this line, below that, this is this part that extend up to the ischiopubic rami, that is the adductor magnus muscle. Okay, the medial aspect with fibrofatty tissue, so we can sit on the ischial tuberosity. Okay, we got that. Okay, now we'll again put emphasis on the iliac crest. Okay, this is the iliac crest. This is that iliac crest. Okay, iliac crest. It has ventral segment, dorsal segment. Ventral segment is 2/3, dorsal segment is 1/3. It is outer lip, inner lip, intermediate area. Okay, we have this is the pelvic surface. Okay, this is the sacroiliac surface, the auricular surface here, auricular surface, sacroiliac surface. This part is called ischial tuberosity. The part here, this is called ischial tuberosity. Okay, so we'll go to the ischial crest now. Ischial crest, we are saying sartorius, origin from where? From the anterior superior iliac spine, and we also get here, same place, we'll get the attachment to the lateral end of the inguinal ligament. Okay, then outer lip, enter outer lip, we have the attachment for the fascia lata, and anterior 1/3 origin of the tensor fascia lata. Okay, external oblique around 2/3 on the outer lip, and intermediate area 2/3 is covered by the internal oblique, little bit longer than that of the external oblique. So this is the origin. External oblique is the insertion. And the inner side, inner lip, is the site of origin of the transversus abdominis and transversalis fascia. Okay. Then if we go just behind the highest point is the point on the iliac crest just behind the midpoint. We get the highest point here. At the highest point, we have the, on the outer surface, we have the origin of latissimus dorsi. On the inner surface, we have the origin of the quadratus lumborum muscle. If you go posterior aspect, we have the dorsal slope for the origin of the gluteus maximus muscle, ventral slope for the origin of the erector spinae muscle. Okay, we got that. Okay, we know the parts of the ilium. Okay, so the part of the ilium contribute 2/5 of the acetabulum, ischium contribute 2/5 of the acetabulum. Okay, 2/5 of the acetabulum, and pubis contribute 1/5 of the acetabulum. Okay, so what is the vertebral level of the highest point of the iliac crest? The spine at the level of the lumbar spine, 3rd and 4th. Okay, we got that. Now, what are the ends of the iliac crest? Anterior superiliac spine, posterior superiliac spine. You read this part. Attachment of the anterior superiliac spine. What is the dimple for posterior superiliac spine? 4 cm lateral to the second sacral spine. What is the tubercle of the iliac crest? It is the outer lip of the iliac crest, 5 cm posterior to the anterior superior iliac spine. Okay, we got that. Now, what are the attachment of the ventral segment of the ilium? We just discussed that part. What is the attachment of the dorsal segment of the iliac crest? We discussed. Okay. What is the attachment of the anterior inferior iliac spine? We have to know that. Rectus femoris. Which head of the rectus femoris? The straight head plus the iliofemoral ligament. Okay, we got that. How is the gadarsciatic foramen? Gadarsciatic notch is bounded. How the gadarsciatic notch is converted into gadarsciatic foramen? What muscles pass through the gadarsciatic foramen? Answer should be Piriformis muscle. What structure passes through the what structure passes above the piriformis muscle? Supergluteal vessels and supergluteal nerve. Okay, so what structure passes below the piriformis? Again, a lot of structure. You have to know that part. Identification of the arcuate line. We have the arcuate line here. This is the arcuate line here. Arcuate line. Okay, so it is the iliac part and the pubic part of the arcuate line. Okay, that should separate the false pelvis from the true pelvis. Okay, we got that. Now, what muscles are attached to the gluteal region? We just discussed that part. Attachment of the sacrotuberous ligament, the sacra to the ischial tuberosity, that also attached to the posterior border of the ilium. Okay, attachment of the sacrotuberous ligament. Okay, so we must know that part. Capsule of the hip joint margin will get also acetabular labrum, and the fibrous capsule here will get fibrous capsule and the acetabular labrum here. Okay, here we just discuss the muscle. Here on the pectineal surface, we have attachment of the pubic tubercle, the inguinal ligament, then lacunar ligament, then pectineal ligament. On the pectineal surface, we have the attachment, that is the origin of the pectineus muscle. Pectineus muscle has dual innervation. It is innervated by the femoral nerve as well as the obturator nerve. Okay, we got that. Then we covered everything that okay, here we look at that. the gluteus maximus, it also takes origin from the sacrotuberous ligament. Sacrotuberous ligament is also attached to the posterior border of the ilium, going to the ischial tuberosity. Here we have the sacrospinous ligament, and this sacrospinous ligament convert the greater sciatic notch to a greater sciatic foramen. We'll also get the lesser sciatic foramen here. Okay, and this is the obturator foramen. Okay, ligaments are very important to us. This is the ligament, the iliolumbar ligament, attaching here, iliolumbar ligament here. Okay, there is the attachment here. The attachment is here, the iliolumbar ligament. Okay, on the posterior aspect of the iliac crest here. Here is the upper part, iliolumbar ligament. This is the anterior longitudinal ligament that passes over the sacrum also. This is sacrum here, and female we have the wide sacrum. Okay, we got that. And we have the anterior sacroiliac ligament. Yes, we have the anterior sacroiliac ligament. This is the sacrum. Okay, this is the sacrum, and our ligament should be here. Is the ligament. This is the ligament here. The anterior sacroiliac ligament here. Okay, we have the interosseous sacroiliac ligament. We have the posterior dorsal sacroiliac ligament. So if you go there, here, okay, here is the ventral sacroiliac ligament, interosseous sacroiliac ligament, the dorsal sacroiliac ligament. Okay, this is the auricular surface. We have also a pre-auricular notch here that is prominent in female. Okay, we got that. Again, we have the gluteus maximus muscle here. Here is the gluteus maximus muscle here. Then we have the gluteus medius. Then we have the gluteus minimus muscle. This is the anterior superiliac spine. Anterior inferior iliac spine. This is the acetabulum, the lunate surface, and the gap here, depressed gap, is the gap between the lunate surface is the acetabular notch, and this depression is the acetabular fossa that contains fat. The acetabular notch is connected in our body by the transverse ligament. Okay, we got that. Again, ischial tuberosity here. We will divide this part by transverse line. Again, superolateral part, inferomedial part. We have the semimembranosus. Then we have the biceps femoris long head and the semitendinosus. We have the adductor magnus muscle. This is the site for the adductor muscle. We have the gracilis here. Gracilis, the adductor longus, brevis here, and outer part will get the obturator externus muscle. Okay, so we got the muscle here, and piriformis also get origin from here, from the posterior inferior iliac spine area. Partly it is taking origin mostly from the sacrum, but this is also a site of piriformis origin. Okay, so our levator ani taking origin from the body of the pubis posteriorly, also from the ischial spine. Okay, so to find out the greater sciatic foramen, lesser sciatic foramen, obturator foramen. This is the obturator canal. What are the contents of obturator canal? Obturator vessel, obturator nerve. Obturator nerve is coming from which plexus? The lumbar plexus. What is the root value of the obturator nerve? Lumbar 2, 3, 4. Obturator artery is a branch of what? Internal iliac artery. This is what? The inguinal ligament. This is what ligament? The lacunal ligament. It extends as the pectineal ligament. Okay, we got that. This is sacrotuberous ligament, sacrospinous ligament. Okay, we have to know that. We just discussed that part. Okay, acetabulum contribution, identification, acetabular notch, acetabular fossa, lunate surface. Okay, we have to identify this all. Okay, here important point, in the greater sciatic foramen we have the muscle, the piriformis, some structure passes above the piriformis. What are those structure? Supragluteal nerve and vessel. Structure passing below the piriformis. What are those structure? Sciatic nerve, inferior gluteal, posterior femoral cutaneous nerve, nerve to the quadratus femoris, and the inferior gluteal nerve. And this is the lesser sciatic foramen. What structure passes to the lesser sciatic foramen? Okay, lesser sciatic foramen structure passes the pudendal nerve, internal pudendal vessel, nerve to the obturator internus. These are related to this part here. Okay, this part is related just behind the ischial spine, is related to the pudendal nerve, pudendal vessels, and nerve to the obturator internus. Those enter into the lesser sciatic foramen. Okay, we got that, and we know the muscles here, muscular origin here. From the ischial spine, lesser sciatic notch, we have also origin of the gemellus superior, gemellus inferior. Okay. Okay. So we got that. How to determine the sex of the hip bone? Many way. Greater sciatic notch is narrower in male. Greater sciatic notch is wider in female. Acetabulum is large. So acetabulum is large in male. The transverse diameter from here to here is same as the anterior margin to the pubic, to the anterior margin of the symphysis pubis from the anterior acetabular margin. Okay, to the anterior margin of the symphysis pubis is same. Okay, in case of female, this part is longer than that of the acetabular transverse diameter, because in female acetabulum is smaller. Okay, subpubic angle. Subpubic angle is actually, yes, this is the my finger, pinky is in the subpubic angle, just under the symphysis pubis here. This is the subpubic angle area. Okay, that is less than 70 degree in male. It is more than 80 degree in female. And also we have the preauricular sulcus that is very much close to the upper part of the greater sciatic notch, that is prominent in the female. Okay, we got that, the difference between the male and female hip bone. Attachment of the anterior surface of the pubis, we just discussed that part. What are the attachment of the posterior surface of the pubis? Levator ani, obturator internus, puboposterior ligament. Attachment of the pubic crest, we just discussed, rectus abdominis muscle, pyramidalis, and anterior wall of the rectus sheath. In the pubic crest, we have also attachment to the conjoint tendon. Okay, there is a tendon formed by the transversus abdominis and the internal oblique. Okay, what structure is attached to the pubic tubercle? We have done that, and pubic tubercle is also crossed by the spermatic cord, and the upper part of the ramus of the pubis is also related to the spermatic cord in the vas deferens in male and round ligament of the uterus in female. Okay, we got that. So what structure passes through the obturator canal? We just discussed that part. Okay, this image is very important to us. Everyone should know this has been taken from the Gray's Anatomy for the students. So this is from the Gray's Anatomy for the students. So everyone should know what structure passes underneath the piriformis, what structure passes above the piriformis. Okay, so this is very important to us. And what are the contents of obturator canal? So this image I have taken from the Gray's Anatomy for students. What structure passes underneath the inguinal ligament? Multiple muscles, vessels goes underneath the inguinal ligament. This is very important to us. Okay, we just discussed that part. hip bone. Okay, this is the radiology of the hip bone. This is the radiology of the adult hip bone. Okay, like this. We have three pieces of bone forms one hip bone. Another name is innominate bone, ilium, ischium, pubis. They are connected by triradiate ligament. It's a triligament cartilage, not ligament, and that is epiphyseal plate between these three bones, and this is ununified in the children. Okay, this is the radiograph of a right acetabulum of a child. It seems to be fractured. It is not fractured. Here we have the epiphyseal cartilage. It will be closed by around the age of 17 to 20. It will be closed totally. And the hip bone has 3 primary center of ossification, around 5 primary center of ossification. 3 primary center of ossification, 1 for the ilium, 1 for the ischium, 1 for the pubis. Secondary center, 2 secondary center of ossification, 2 for the ilium, 2 for the acetabulum area, and 1 for the ischium. We may have separate center of ossification for the anterior superior spine or ischial spine. Okay, so again, these 3 components are connected by epiphyseal cartilage. We call it triradiate cartilage. It is hyaline cartilage in structure. Okay, and that's all about the hip bone. If you have any question, please feel free to ask me. Please share the information with your friends, and please support my channel. Please subscribe me. Have a nice day. Bye now.